I want to talk about the axial skeleton, the second part. So we have talked about the skull already, and I want to talk about the mandible now. So here's the mandible, here's the maxilla. So the maxilla bone is the upper jaw, the mandible bone is the lower jaw. And then we have the mandibular notch right here. Here's your mandibular notch. And here is the mandibular condyle, or the condylar process of the mandible. Condylar process of the mandible, or mandibular condyle. And let's move on to this isolated mandible here. So right here we can see the mandibular condyle, or the condylar process of the mandible. So mandibular condyle right here. And then we have the notch right here. And then we have the coronoid process right here. Now, we have this structure right here. So if we're looking in like this. So this structure right here is the mandibular foramen. Mandibular foramen here, as well as right here on the other side. So hopefully you understand this here. So this is your mandibular foramen. Mental foramen right here and right here. Mental foramen right here and right here. Velar margins are processes. All these right here. Now, remember, I told you about the velar processes, or the velar margins right here of the maxilla bone, and here they are of the mandible bone. Okay, we have the mandibular ramus. Mandibular ramus is right here. The ramus is a square-like structure. Here we see mandibular ramus. Okay, let's do the hyoid bone. So take the skull off. Here is your hyoid bone right here. And let's continue with the atlas bone and the axis bone. Let me take this skull off here so I can show you the first two cervical vertebrae. So right here we have the atlas bone, and then you have the axis bone. And if you look right here, if you ignore the steel rod sticking out, you can see the atlas bone and then the axis. Atlas, axis. Okay. And then right here we would have the hyoid bone. What are these? You should know by now. Intervertebral disc. Here, here, here. Okay, so let's do some structures of the atlas bone. Now, this right here is showing you the atlas bone. You see this structure here and this structure here? Those two structures are the superior articular facets. And when you look at the skull, the occipital condyles of the skull, these two structures here and here, the superior articular facets, as we see here, are going to fit right there. And hopefully you'll nod yes. So the atlas is called the yes bone. And then if you look at the inferior surface of the axis, you'll see these two structures, and these two structures would be called the inferior articular facets. So superior articular facet here and here, and inferior articular facets here and here. Superior and inferior. This hole right here is called the vertebral foramen here, where the spinal cord goes through. Got to show you some more structures. So when you look at the atlas bone or any of the cervical vertebrae, you will find the transverse process here and here, here and here. Now, associated with the transverse processes, you have the foramen. So this would be the transverse foramen right here. This structure right here would be a transverse foramen. Transverse foramen. And transverse foramen. What is this structure here? Hopefully you'll know that's the vertebral foramen, where the spinal cord goes through. Now, the vertebral artery is going to go right through the transverse foramen here. Now, let's do the posterior arch. The posterior arch is just this structure right, well, this structure right here is your posterior arch. Now, let's do the axis bone. So the axis bone is right here. Let me move this tag here. Well, it doesn't want to move, does it? Well, hopefully you can see this. So this is the axis bone, and this is looking at the superior view here. And we have a structure that sticks straight up. And let me show you. This structure that sticks straight up is called the dens, or odontoid process. Dens or odontoid process. And then we can see right here again, superior articular facets here and here, which articulate with the inferior articular facets, which articulate with the inferior articular facets of the atlas bone, like this. And we can see the atlas here and the axis bone. And on the inferior side, we can see the same thing. Let me turn this around. Move this tag here. So we can see pretty much the same thing. So we see the inferior articular facet here. Same thing here. Inferior articular facet here and here. And then we have the vertebral foramen. And then right here, we have these structures. Again, you should know this structure. And this structure would be the transverse foramen. Right? Hopefully you understand that. And let's look at it on this side. So they're a little bit hidden now. And you can pretty much see right here, transverse foramen and transverse foramen here. And let's see if there's anything else. Okay, let's grab a thoracic vertebrae here and look at some structures now. So here is a thoracic vertebrae here. That's a thoracic vertebrae. Once you get past the atlas and axis, this is what the cervical vertebrae look like. So you'll notice the transverse process here and here. It's been broken a little bit there, but you can see the transverse foramen here and here. Spinous process here. And we can see the facets right here and right here. So spinous process, vertebral foramen right here. Body. Cervical vertebrae have a small body. Okay. Now, if you look at the superior view of thoracic vertebrae, you can pretty much see that you have a body here. Next, we have the vertebral foramen here, where the spinal cord goes down. And then next, we can see that you have your intervertebral foramen here, which is where spinal nerves are shooting out right through here. Let me show you this here as well, so you can see this region here. Well, it's harder to see, but you can pretty much see this area right here is where the spinal nerves are shooting out. Here, here, here. Well, sorry about getting off. Here, right there. And on the lumbar vertebrae, they have this model here that's showing you the green structures coming out through the intervertebral foramen here, here, and here, and here. Okay, so remember, body, so the body right here, vertebral foramen, and then you have your intervertebral foramen, right here, what the probe's pointing to. And then we have the transverse process. Notice that the thoracic vertebrae do not have foramina associated with the transverse processes. So right here is a transverse process. Right here is a transverse process. Notice that you have facets on these transverse processes where ribs attach. Right here and right here. And then we have the spinous process on the dorsal aspect right here, right there. Spinous process on the posterior part or dorsal part of the vertebrae. And then I have to show you two more structures as well. Pedicle is this structure right here. We'll do right. Pedicle. And then we have the lamina. Right here. And right here. Right there. And pedicle is right there. And let's see. Let me show you those structures here. So if you look right here, you will find the transverse processes here, here, here of your thoracic vertebrae. Sorry, right here, excuse me, I don't want to confuse anybody. We have the spinous processes. We have the spinous processes right here. The dorsal aspect of your vertebrae. Spinous processes. All these right down through here. Now the transverse process is right here. Remember, a transverse process has facets that's going to articulate with the rib. So right here we have transverse process and then spinous process here. Right here we have the lamina. Here's the lamina right here. Okay. We have the types of vertebrae now. I've already mentioned this. So you have 7 cervical. There are 7 of these. You can see the transverse process right here. Excuse me, keep on saying the wrong thing. The spinous process right here, right here, right here, right here. Spinous process. And then we have the transverse process for the first cervical vertebrae right here. Notice that you have transverse foramen right here, as well as right here. And notice that the cervical vertebrae are the only vertebrae that have transverse foramina on the transverse processes. Now, we have the thoracic vertebrae, which are going to be all these right here. Thoracic vertebrae, there's 12 of these. And then we have the lumbar right here, and there's 5 of these. And I forgot to show you a lumbar vertebrae. So this is a lumbar vertebrae, and there's 5 of these vertebrae. So here's a lumbar vertebrae right here. Here we have the body. Here we have the vertebral foramen, spinous process, transverse process, transverse process. Same thing here. Body, vertebral foramen, spinous process, transverse process, transverse process. Now, this right here shows you a thoracic vertebrae. So remember, body, vertebral foramen, spinous process right here, and then your transverse process and transverse process. Notice that there are no ribs attached to the lumbar vertebrae, but there are ribs attached to the thoracic vertebrae. So you have facets right here associated with the transverse processes right here, as well as right here associated with the body. And let's move on to the ribs. So we have the ribs now. Now, if you look at the ribs, you'll have the true ribs. Ignore the clavicle bone. So these are all your true ribs here. And there's 7 pair of these true ribs. These true ribs are also called the vertebral sternal ribs. These true ribs are also called the vertebral sternal ribs. Next, we have the vertebral chondral ribs. And there's 3 pair of those. So, right through here. And then we have the floating ribs, which are right here. These floating ribs are not connected to the hyaline cartilage here, or the costal cartilage. So this right here, this cartilage right here is the costal cartilage. It's hyaline cartilage. And I want to show you an individual rib. So here's an individual rib right here, and we can see the head region here, and this is the tubercle region here. Let me move that over here. I don't know if you can see this or not, but this is the tubercle region. Gotta go to it. Tubercle region right here. And then we have the shaft, which is all this right here. Here you can see the tubercle maybe. So head, and then the neck region here, and then the tubercle right here, and then the shaft. So head, neck, tubercle, and then shaft. And let me show you this right here. So, as I've mentioned before, when you look at the ribs, at the articulation with the spinous process, when you look at the articulation of the transverse process right here, transverse process, when you look at the articulation of the transverse process of the rib, this is what you're looking at. So you would see the tubercle right in here, and then you'd have the neck and the head region right there, and then we have the shaft going around right through here, and then have the shaft right here. Now there is a groove associated with these ribs. I don't know if you can see it or not, but there's a groove in there where blood vessels and nerves are going to be associated with that groove. We have the sternum now. So here is the sternum bone. Looks sort of like a shaft of a sword. So this is the manubrium right here. This is the body of the sternum, and this right here is the xiphoid process. And we have the sacrum bone right here. There's your sacrum bone right there. And we have the intervertebral disc, the disc right here. And then this area right here would be called the sacral promontory. This area right here is called the sacral promontory. We have the foramina right here. And then if you look right here, we have the foramina here, here, here. And then we have the sacroiliac joint, which I've probably showed you already. So here's your sacroiliac joint right here. And right here. And then we have the pubic symphysis right here. And then right here we have the coccyx bone. Well, let me right there. There's your coccyx bone. And there's your hip bone. Here is your sacrum bone. Sacrum bone is right here. And then this structure right here is the sacral canal. This is your sacral canal right here. And let me show you this on this sacrum bone here. So this is a real sacrum bone. So this is the dorsal part of your sacrum bone. So here is your sacral canal right here. Your sacral canal right there. And right here, this structure is the sacral promontory right there. It's going to articulate with the L5. And then we have the coccyx missing, but we have this fake sacrum right here. And then the coccyx bone right there. And that's it.